7 diabetic symptoms you must recognize. Are your blood sugar levels alright, or are they higher than usual? Why is it essential for you to gain a deeper understanding of this condition? The reason is straightforward. Complications linked to diabetes claim a life somewhere in the world every 10 seconds. Diabetes claims the lives of 3.5 million people on the planet every year, and the forecast suggests this could increase by 25% in the next decade. That's why it's super important to stay alert. In this video, I'll talk about 7 warning signs of diabetes, things you can notice or feel that might be a sign that something's up. Just like little warning signs. Number 7, frequent urination. Do you find yourself going to the bathroom a lot? Did you know that the word diabetes comes from Greek and means siphon, which refers to peeing a lot? And here's an interesting bit, mellitus comes from Latin, meaning honey. Back in the old days, doctors would taste urine and notice it tasted sweet. Believe it or not, for folks with uncontrolled diabetes, their pee might even attract ants to the toilet. That's because the sweet stuff in their pee is sugar that their kidneys are getting rid of. See, their bodies struggle to handle sugar like they should, so it ends up coming out in the pee. And when sugar is in the pee, it drags water with it, leading to something called osmotic diuresis. That's why people with diabetes often feel like they just can't satisfy their thirst. Their mouth and throat get all dried up because they are peeing out sugar, which leaves them super thirsty. So, going to the bathroom a lot and feeling like you just can't stop drinking are classic signs of diabetes that you should pay attention to. Number 6, fatigue and tiredness. It's not the kind of tiredness you might feel after a night of poor sleep. It's quite the opposite, actually. There are times when you've had a good night's rest, yet you still find yourself burdened by constant and overwhelming fatigue. Believe it or not, this could be a sign of diabetes. According to the American Diabetes Association, more than 60% of folks who've just been diagnosed with type 2 diabetes experience this kind of extreme tiredness. In fact, it's the second most common symptom of diabetes. This exhaustion is tied to the fact that there's a bit of a sugar struggle going on within your cells and bloodstream. In simpler terms, the sugar isn't getting into your cells properly, which leaves them drained of the energy they need. And that, my friend, leads to that all-encompassing feeling of tiredness and fatigue. Number 5, skin changes. There are 2 significant changes you should be aware of. The first one is called acanthosis nigricans. These are dark patches that appear on the skin, often in the folds of the neck, armpits, or groin area, and they might feel soft and velvety. Just take a moment to look at your neck or under your armpits. Do you notice the skin being darker than usual? No matter how much you scrub, rub, or apply creams, it just doesn't seem to lighten. Now, don't mistake it for dirt. It's actually a sign of insulin resistance. Acanthosis nigricans is like a signal telling us that there's a significant chance you might have diabetes or could develop it down the road. But why does this occur? Well, in cases of prediabetes or type 2 diabetes, the body can sometimes end up producing more insulin than it needs. This extra insulin prompts the skin's normal cells to divide at a quicker pace. And for folks with darker skin, these new cells tend to have more melanin. This surge in melanin production is what leads to those dark skin patches. The second change you should keep an eye out for is these small growths that resemble tiny warts. They're known as acrocordons. And guess where they often pop up? Right on the neck, under the arms, and in the groin area. The very same places where those darker skin patches tend to appear. This is also linked to insulin resistance. However, here's the good news. If you're managing your glucose levels effectively, these fibroepithelial polyps might just stop forming altogether. Now, some folks might not be big fans of these growths due to their appearance. So, remember to watch for these changes, the dark patches and these small growths. They might seem subtle, but they could provide valuable insights into your health, especially when it comes to diabetes. Number 4, tingling and burning sensations. Did you know that diabetes and prediabetes are the number 1 causes of burning feet? Yes, elevated glucose levels attack the nerves, leading to diabetic neuropathy. Nearly half of diabetics experience diabetic neuropathy. The numbness usually begins in the feet, following a boot-like pattern, where numbness progresses from the toes to the legs. Pay attention, high glucose levels not only damage nerves but also compromise your vision and kidneys. For men, this nerve damage can even lead to impotence. I understand that the heat and numbness in your feet are uncomfortable and painful, but they could be warning signs that your body is undergoing distress. Number 3, frequent infections and inflammations. When the sugar in your blood isn't well controlled, it can mess with your immune system, which is like your body's defense team. This can make you more likely to get infections and inflammations, even if you've never had them before. Imagine someone who's usually healthy but suddenly starts feeling sick. They might get pneumonia, urinary infections, and skin issues like boils and skin bumps. They might even have things like thrush in their mouth and private parts. Something isn't right, and one possibility could be diabetes. You see, things like fungi really like sugar. They hang out in warm and moist areas like your mouth, private parts, armpits, and groin. They might make you itch, and sometimes even hurt or burn. Another common problem for people with diabetes is gum issues. High sugar levels in your blood can lead to high sugar levels in your spit, which helps bacteria grow. These bacteria can cause problems in your gums, like gum inflammation and even something called periodontitis. That's when your gums and the bones holding your teeth get all swollen and angry. If you don't treat it, your teeth might get loose and fall out. Diabetes makes you more likely to have these gum problems. It's about 3 times more common in people with diabetes. So if you're having a lot of infections, especially in your mouth, it might be worth checking if diabetes is in the picture. Number 2, blurry vision. Is your vision not as clear as it used to be? Are things looking blurry or fuzzy? It could be diabetes. Once again, if your blood sugar levels are high, it also increases the sugar inside your eyes. As I mentioned earlier, when there's sugar around, it draws water in. So, the lens of your eye swells up and changes shape. When that happens, the image you see becomes unfocused. That's why sometimes people with diabetes experience blurry vision. Keeping your blood sugar under control is crucial for maintaining healthy eyes. By the way, just to add a side note, diabetes is one of the leading causes of adult blindness worldwide. It raises the risk of diabetic retinopathy, cataracts, and glaucoma. Number 1, excessive hunger and weight loss. Diabetes might make you feel even hungrier than usual, especially for sweet and sugary foods. That's what we call diabetic hyperphagia. It's like being hungry all the time. This happens because your body thinks it's running low on energy, so it makes you even hungrier, hoping to get that energy back. There are also changes in how your hormones control your appetite. This is because high insulin levels mess with a hormone called leptin, which helps tell you when you're full. When leptin is low, you keep feeling hungry, even after eating. Surprisingly, even if you eat, you could still lose weight. That's because your body isn't using the sugar as it should, so it comes out in your pee. Since your body can't use glucose properly, it tries to find other sources of energy, like breaking down muscles. This ends up making you lose both weight and muscle mass. Understanding these signs empowers you to take control of your health. But remember, knowledge is just the first step. Taking action, including seeking professional medical advice, is equally important. If you want to learn more about managing diabetes and making healthier choices, I encourage you to watch this video, 10 foods you should avoid if you have diabetes. Your health matters, and every proactive step you take today can make a significant difference in your tomorrow. See you in the following video.